got going with all the stuff we talked about.
Yeah.
You know, I did refer a few people over there, and I don't know what the hell happened. They couldn't get through, and this and that, and then they didn't want to be bothered. So
Yeah, and then people sometimes they just
yeah.
after a certain point.
Just tell me when you're ready.
I'm good.
Okay, we got Mike here. It's a patient of ours here, and he's going to get some work done. We start off with some body work, which is some relax his muscles, and then we're going to adjust whatever necessary to get him to optimum performance, and then we're going to stretch him out and get him where he needs to be. So we already did a evaluation on Mike several times, x-rays, MRIs, so we know clinically what his needs are as far as what I can perform for him today. So I'm just doing a little simple body work. It kind of relaxes his muscles. Usually we do this right after he's been relaxed with some muscle stimulators and moist hot compresses and things of that nature. So right now I'm just doing some just simple body work just to loosen up the areas that we're going to be working with.
This is where I fall asleep.
Now, any real athlete that does not get themselves taken care of is like a race car not getting service for a race. Eventually they'll break down and they'll have problems. So Mike, fortunately, is not one of those people.
You got good people around me.
Same here. So in a way, we're kind of work together as a team. This is a simple one. We also do other types of athletes. We do a condition called myofascial release, which is breaking up adhesions or scar tissue that develop in the muscles. So this is something very simple we'll be doing for Mike today. Okay, so now we've relaxed him. So when we do an adjustment, it's going to work a lot more efficiently, and we won't have the resistance of muscle spasms or pain or anything like that, preventing us from making efficient adjustment. So the first adjustments we're going to be doing is to the thoracic or spinal and mid-back area. So what I'm going to do is just going to feel what's out of alignment, and we're just going to put it right back into place. He's going to take a deep breath, and he's going to exhale. That's it. Now that sound you're hearing is not the breaking of anything. It's actually nitrogen gas that's in each joint of the body. As the joint moves into its normal position, that nitrogen gas escapes from one area of the joint to the other and gives a popping sound. You've heard of the bends, right? Well, that's nothing more than nitrogen gas bubbling out. So nitrogen is in our bodies all the time, and it settles in our joints. So one of the symptoms of the bends is joint pain, because it's bubbling out of your joints. Okay? I'm going to do another one right here. Just going to take a deep breath. Exhale. That's good. Perfect. Now we're going to adjust certain areas of his lumbar spine and his sacrum. And I'm going to check a leg length here, and this shows us the body mechanics, whether it is favoring one side or the other. I'm also feeling or palpating to see what's out of line or not. So we're going to make some adjustments to his lumbar spine and sacrum. So he's going to lie on his right side. He's going to face me. I'm going to put him in a position that isolates the lumbar spine as we make the adjustment.
Good.
And we're going to go the other side and move the bone.
I'm a pro at this by now. I know exactly where to go, how to put my limbs.
Again, we're isolating the lower back area so that that's the only vertebrae that moves.
Good.
Okay. Now, we're going to feel or palpate again his cervical spine or neck region. We're going to see what imbalances there are. I'm going to ask for his hands, and he's going to do hand length. He's going to point his fingers towards me, both fingers, that's it. And we're going to see there's a little imbalance where his left arm appears to be a little shorter than the right, and that's just because the muscles are pulling more on this side, and so is the vertebra. So we're going to move his head into a position where we're isolating certain vertebrae, so that's the only ones that move, and that's it. When you get your neck adjusted, it sounds very loud because it's right by your ears. And then we're going to, again, isolate the cervical spine so it gets adjusted properly. So I'm going to ask for his hand length again. He's going to point his fingers, and we can see that his fingers are completely balanced now. So now, that's not the end. Now it's what we call fine tuning, where we're stretching the muscles to rebalance with the spine as well. And I can see just the way his feet are pointing in certain directions that there is some things that we have to work on. We're going to work on the psoas muscle right here, or the head flexor. This is one of the main muscles of any fighter because it allows you to move your leg up to your chest. So we're just going to stretch that out a little bit.
Dr. Rob, what do you think is the most common injury you see in combative athletes, specifically more like boxers and strikers?
Shoulder, cervical spine, and wrist.
Can you just let everybody know, like, that obviously they don't know as much about your background, how, you know, you worked as a medical consultant? Like, how would you word?
Okay, I started off as a chiropractor 31 years ago. Graduated New Chiropractic College in 1984. From there, I went into private practice and started doing private patients and athletes because I was an athlete myself. So I thought that was not enough, so there was something in our profession, as there are in the medical profession, diplomat or fellowship programs. And my first program was sports medicine and rehabilitation, so that was a 3-year postgraduate education in that kind of studies, where we worked on all professional athletes, pre and post injuries, surgeries, things of that nature. We did our training at the Meadowlands, so and NYU, so we had extensive training there. So I got involved very heavily in the sports community. Everything from triathletes, which we did sponsors for many years. I did ring doctor for many years. Baseball, football, basketball, you name it, I've done just about every sport there is out there. So then the need was developing for treatment and diagnosis of head injuries, because a lot of boxers were having head injuries, football players, hockey players. So I went back to school and got my fellowship in neurology, which again was a 3-year postgraduate education program. So I did that for a while, and we were doing the sports medicine, we were doing the neurological workups and treatment. And that involved a lot of radiology, MRIs, CAT scans, sonograms, things of that nature. So I found that I was pretty good at that, so I decided to go back to school and spend another 3 years to become a radiologist. So with over the years, I've had 9 years postgraduate education in fellowships. So I started to treat all kinds of people and all kinds of injuries, which got so busy where now I started hiring, physical therapists, pain management specialists, orthopedists, neurologists, um, acupuncturist, massage therapist to help me with this. So now I still do chiropractic, but all the other stuff I supervise as well, and we have 3 multidisciplinary clinics. So any kind of injury that you possibly have, we can take care of. So when I met Mike and we wanted to talk about how we can integrate more of what he does with what I do, he came up, they said he had Life of a Fighter, which as we know what that does, but now we integrate what we call an aftercare program where patients that are injured, there is a gap between able to go back to the gym and leaving rehabilitation. And this is where Mike comes in, where he's able to bridge that gap between what I'm done with and where they want to go into the gym. And that's where we've been working with.
Basically, Ron's the man. I don't know if you guys know that, but
we're just doing some stretching here. So now, with Mike's tremendous help and assurance, he's going to turn